Welcome to the Media Planet Health Stories interview series. Joining me today is Dr. Sonja Hughes, Vice President of Community Health for Susan G. Komen. She's a board certified OBGYN who's practiced for more than 20 years, and she's now focused on improving healthcare equity. Thanks for joining me today, Dr. Hughes.
Thank you so much for that great introduction. And yes, I'd love to have this conversation as I feel that not everyone understands what we mean when we say health equity. And it's a perfect topic that relates into the need to talk about breast cancer as well.
I guess I'll kind of start right there. What does health equity mean to you, and what would you like anyone listening to our conversation today to know about that?
Health equity simply means everyone should have a fair and equal opportunity to access health care. And it should not matter where you were born. It should not matter where you live. It shouldn't matter what you believe in, what you practice. Everyone should have a fair and equal access to health care. And it's also important with health equity for all of us in the ecosystem to understand how, in order to achieve health equity, we must personalize the care of the patient.
Make the patient that priority.
Absolutely.
Okay, well, let's get started. One of the things that I read was kind of staggering to me was a statistic that said that Black women are 40% more likely than white women to die from breast cancer. And that seems like such a significant difference. Can you tell me what's going on?
I think it's important to understand, first of all, the definition of disparity. And you mentioned a disparity, and basically, a disparity is when there's a difference in an outcome between one group and another group. So, as it relates to the outcomes of death or mortality from breast cancer, there's a disparity between Black women in a comparison group, white women, where Black women are 40% more likely to die than white women if diagnosed with breast cancer. And the reason why this becomes so important is you must understand the disproportionate outcomes in order to then look for the cause and do your part to address the cause. And that's what Susan G. Komen Foundation has done. We basically looked at that disparity and we wanted to better understand it. And by better understanding it, we pulled together information and published our Closing the Gap report in 2021. It was the first of its kind study in which we were able to dig deeper into the disparities of that statistic. And actually, what we found was in some metropolitan areas, Black women were as much as 60% more likely than white women with mortality in breast cancer.
And so, what are some of those disparities that you're seeing? And you're noting that they're higher even in some other communities, different cities, different populations. So, are there any examples that you could give us of those disparities?
Yeah. In addition to the mortality disparity with Black women as compared to white women, other examples of disparities that impact communities are Hispanic women are more likely to be diagnosed with breast cancer at a later stage than white women. Women, period, women living in rural areas who may have limited access to health care are less likely to get a screening mammogram than women who live in urban areas. That's an example of a disparity between communities, rural areas and urban areas. Additionally, if we look at the lesbian, bisexual women, and transgender men population, they're more likely to be diagnosed at a later stage and have higher rates of recurrence when compared to cisgender women, likely due to discrimination in our health center and in our healthcare ecosystem. And then one last disparity that we have noted, also another example, is only about 29% of uninsured women were up to date with breast cancer screening in 2021. More recent data is available. As we know, 2021 came on the heels of the pandemic in 2020. But that statistic in 2021, and when you looked at uninsured women, they were not up to date with breast cancer screening as compared to 67% of women who actually have Medicare or who have insurance. And most data lags a few years, so that we feel was not even impacted by the pandemic. And our more recent study has also confirmed that uninsured women are more likely to be behind and lag in their screening than women who actually have insurance.
Seems like there's a large range of, whether it's access to healthcare or screenings or just maybe in individuals, their hesitation, maybe even to get tested, those kind of things that so many different disparities. How do you approach it? How has Komen approached it to make sure that you can
You
understand
know,
these disparities?
that's hugely important because it's first of all obtaining the data so that you can better understand the data, and working to achieve health equity has actually been a part of Komen's mission since we were founded in 1982. And an interesting fact is, Komen began as a gender equity organization. We brought the discussion about women's health and empowerment out of the shadows and into the forefront. And this was at a time when people wouldn't even say the word breast out loud. And so since then, we've worked with the framework addressing various aspects of health equity. We have found that there are four foundational elements that drive the impact. And these are elements that we can use as building blocks to put interventions. And so when we look at the foundation and we look at the framework and levers that could change how we approach disparities, education, number one, making sure everyone understands what do we mean by screening, what do we mean by diagnostic testing, et cetera. Secondly, patient support. Whether a patient is deciding or unsure about whether or not to be screened or to have certain tests, or whether or not a person has been diagnosed with breast cancer, patient support is hugely important.
Mhm.
Thirdly, is research. As we look at the disparities, as we look at the disease, understanding the research, the science behind it, and Komen has been a huge supporter of a lot of the research, a majority of the research involved with medications used now to treat breast cancer. We also understand the importance in a framework of public policy, working together to advance policies so that access to care and other factors that are related to policy or are impacted by policy can eliminate that barrier. And then lastly, it's important to develop a workforce. Those who work in the healthcare field, those who work to support patients, those who work in advocacy, that's also an important aspect of a lever that we can use to further address the issues of disparity so that health equity can be achieved.
Excellent. You guys are on the top of this. You've been doing so much. In your time, both as an OBGYN and also with Susan G. Komen, what have you've seen? What does the future look like? As you mentioned, Komen has done so much, and so many women now have resources that maybe they didn't have 10, 20, 30 years ago.
Mm. Well, I think it's the framework still applies and some of the basic approaches still apply. Number one, collaborating directly with communities, understanding from communities that are experiencing a disparity, understanding potential barriers, potential social drivers of health or social determinants of health, such as transportation or access to you know, care, being in a rural area or transportation to an appointment. So understanding communities, number one. Secondly, I think it's also important with education when you talk about the future, encouraging those who have been diagnosed or who are going through treatment to participate in clinical trials. Breast cancer looks different on with each person, and we learn more with a clinical trial. And really just understanding what that means. And simply that's when medication that has not been tested broadly is tested because there's enough information to show that it may have an impact. And with clinical trials, you increase the participation and you can better understand the medication, and then that medication goes to market. And just having more patients to participate in clinical trials. Also, having patients to understand a lot of the advancements of breast cancer that has come forward because of either clinical trials or research, such as genetics testing, where you can actually, in addition to mammogram, if you're at a high risk category, have genetics testing to see if you're in even a more increased risk for breast cancer so that you can talk with your healthcare provider about the appropriate go forward advancement.
Excellent. Well, Susan G. Komen has supported the Black community in particular with healthcare interventions like screenings, genetic testing, and financial support. Can you tell me more of the ways that Susan G. Komen is supporting these communities that might otherwise not have some of these opportunities to, help their health and have better outcomes?
Sure. Well, first of all, Susan G. Komen supports all women, right? And with the data, discovered that there was we also saw the data that there was a disparity in the mortality of Black women for breast cancer, and so we realized ending breast cancer takes all of us, and everyone deserves a just and equitable, fair, and access to health care. So, with that, we have our patient care center, which is open to anyone on their breast care journey, whether they are wanting to learn more about breast care screening or whether they have just been diagnosed and they don't know what to do. They don't know who to talk to. So, our patient care center um, is built on a foundation rooted in health equity. It ensures that all people can access personalized care. And we give that support through a telehealth model. So anyone can call, it's free of charge. And we have patient navigators, and those are basically your partners walking through your journey with you. So basically, the patient navigator is with a person recently diagnosed or a person with metastatic breast cancer throughout their entire healthcare journey, but our helpline can answer any questions to anyone who has a question. That's one way in which we've partnered and addressed, and it's a personalized care. So we pair up navigators with the person calling. So we match communities, we match ethnic backgrounds, and so our Black women can get specialized care. Our Hispanic, Latino, Asian, anyone, we do personalized care, culturally sensitive as well. In addition, we also offer a financial assistance program. We know that the cost of breast cancer and treating breast cancer is expensive. The needs such as housing, transportation, and groceries sometimes have to be weighed against paying for childcare and medications. And so we do assist those who qualify with that. In addition, we also partner with communities. With faith based organizations, we have volunteer ambassadors through our Worship in Pink program. We know that this is a huge foundation in many communities. And in that partnership with faith based organizations, we've been able to provide some additional support.
Excellent. And do you is there like a website, a phone number? What would that resource be that you would want to pass along to anyone who wants to reach out?
Absolutely. Anyone can find information if they're internet savvy at Komen.org. And also, if they want to call our helpline, I have my notes over here 877 GO Komen, 877 GOKOMEN. And so Komen.org or 877 go Komen. That can get you where you need to be. And our patient care center helpline is there to help you. The internet, Komen.org, you can find it. All of our, you can find information about research, about our Worship in Pink, about the patient care center. If you're interested in the latest medications, clinical trials, all of that is available at Komen.org as well.
You're quite a resource. What would you want anyone listening to this, whether it's a patient, a family member, to know about this breast cancer journey and, worrying that they are maybe not getting the coverage that they want to get or they have questions that are unanswered? What would your message be to them?
Well, first of all, in my years as an OBGYN, I know it's important for patients, people, population to have a relationship with a healthcare provider if that's possible. That's someone that can be a trusted resource, especially if there's an ongoing relationship established already. I also understand that there are some people who don't have an ongoing relationship with a provider, and that's where 877 Go Komen becomes hugely important. Our helpline operators are available to answer your questions, and no question is a silly question, and we're here to help. Also, with Komen.org, we have information on our website. So I think the most important thing that I would leave with most people, as I've always done, is advocate for yourself. And if you don't know how, if you feel like something is wrong, just keep talking to someone until someone finally listens because you know your body more than anyone else. That's why it is important to have an ongoing relationship with a healthcare provider, but also with a trusted family member, if that's who you can leverage or call Komen. Especially as it relates to breast cancer. If it's not related to breast cancer and you still don't know who to call, just call us and we can perhaps guide you in the right direction. So I feel like that's one of the things that I saw a lot. Women would say, I thought something was wrong. I knew I should have come in sooner. Or, I went to my ex doctor, primary care specialist, whatever, and they said XYZ, which I'm sure in that situation that was the best answer. But continuing to advocate if you feel that something is wrong.
That's a great message year round and especially during Breast Cancer Awareness Month. In conclusion, I just wanted to say that I was reading some of your foundational paperwork here, and it was saying that health equity is so important because it belongs to everyone. So, what would your concluding message be that you would want everyone to know about that? That they do have a place at the table.
I think it's just important to drive the message, no matter what you think you knew or what you think you heard about health equity, disparity. The most important message is if we want to overcome barriers to breast health, if we want to end the deaths from breast cancer, we must value and appreciate cultural and demographic diversity of our communities, period. Everyone's different. It takes all of us to end breast cancer. We must acknowledge prior injustices and inequities faced in certain marginalized and under-resourced communities based on factors beyond their control, beyond our control. And just understand that health equity is a strategic imperative, meaning it's hugely important in order for us to address breast cancer, people dying from breast cancer. And just put it simply, health equity is everyone's responsibility, not only at Komen, but in our general population. But at Komen, we take a 360-degree approach. We, as I mentioned, research, policy, community. We listen, we research, we understand that to end breast cancer, it needs all of us.
Excellent. Well, thank you, Dr. Hughes. Thanks for explaining health equity today and just having a very open conversation. Again, if anyone needs to get some more information, they can go to komen.org. Thanks again.
Absolutely. Thank you so much.